Hello, my name is Caitlin Rice. I am a public health nurse for the state of Connecticut. This is my evaluation of a potential childhood obesity disease prevention program that was brought to my attention. The evaluation of the program is intended for the Connecticut State Department of Public Health and whether this is an appropriate program that can be implemented in the city of New Britain, Connecticut. The following presentation is going to be an evaluation of the proposed childhood obesity prevention program and whether it's appropriate and effective for the proposed population. I'll be determining if the target population and setting is appropriate. I will be assuring that the needs of vulnerable populations participating in the program were met. I will ensure that any ethical concerns that were raised in the program were adequately met. And I will also evaluate whether the program has financial viability and what recommendations or changes are needed. The following is an overview of the proposed childhood obesity prevention program. This is a community-based education program that's intended for use in New Britain, Connecticut. The program will target minority children aged 5 to 10 years old. The minority populations include Hispanic and non-Hispanic Blacks since they are at a higher risk for developing childhood obesity. The committee that will organize the program will consist of the school nurse, a public health nurse, teachers, and also community members. The program will be held weekly over 10 consecutive weeks. It will consist of 90-minute sessions. These sessions will be an education program with caregivers and also children involved. And we'll also focus on healthy meal preparation, the importance of reducing the intake of sugary beverages, an increase in physical activity, and reduce screen time. The education sessions will also include healthy recipes, meal preparation tips for parents, and recommendations for physical activity for both parents and children. And the ultimate goal of the program is to prevent and reduce childhood obesity and promote a healthy and active lifestyle within the community. The target population and setting for this program is minority children aged 5 to 10 years old and those children living in low socioeconomic and urban areas. Targeted ethnicity proposed in the program is Hispanic and non-Hispanic Blacks, and the program is intended for use in the city of New Britain, Connecticut. The population and setting is appropriate for this program. New Britain is predominantly Hispanic with populations at 43.3% and non-Hispanic Black populations at 11.2%. New Britain is the 8th largest city in the state of Connecticut and currently has a poverty rate of 21.6%. So many of these children and families are at risk for having a low socioeconomic status, low education. There are also a large number of fast food restaurants and limited access to grocery stores and fresh fruits and vegetables. So this is definitely a population that is at risk for developing obesity. So a program like this would definitely be appropriate for the setting. Recommendations for this program in relation to the population and setting includes expanding the ages to 2 to 19 years old. Children are at a risk for developing obesity throughout childhood and adolescence, so it's important to include children all the way up to 19 years old instead of limiting the age to 10. New Britain, Connecticut also has a very high population of Polish individuals, so it would be important to include materials in Polish and include this population just because of the high number of Polish people living in New Britain. Another recommendation would be the involvement of community resources, including the local YMCA, the public library, community health center, and Central Connecticut State University. The local YMCA would be able to partner with the program to develop physical activities that the children would be able to participate in. The public library would also be able to develop programs talking about healthy eating and physical activity. The community health center would be a way to recruit families into the program. And Central Connecticut State University would provide volunteers or students who may want to participate in the development and implementation of the program. Um, the partnership with the library is very important. Many of the children living in the city attend different activities at the library, so it's important to partner with the library and develop educational programs that the children can participate in after school, as well as this disease prevention program. In this specific program, the biggest population that is considered vulnerable is the children. Children are vulnerable due to their age, immaturity, and inability to understand the impact of decisions related to their physical and emotional health. Um, Children in this program would also likely be coming from a low socioeconomic setting, and this also puts them at a higher risk for vulnerability related to financial resources and access to health care. Vulnerable populations like the children in this program require the protection and guidance of caregivers, healthcare providers, and communities to ensure that they are healthy and striving. And childhood obesity places children at risk for physical, emotional, social, and intellectual harm. So a program like this would be very important and beneficial in a population like this. The proposed program does do a good job in protecting vulnerable populations. It ensures that parents and caregivers are present and consent for the children to participate in this program, and they should also be present at every education session. This is essential in protecting children who may be vulnerable without a parent there. The parents need to commit to attending all sessions prior to starting participation, and they also commit to making family meals, increasing physical activity, and limiting screen time. The program also protects children and the risk to academic performance by including teachers and school counselors on the development committee and also in the implementation of the program. The program also involves a public health nurse from the local health department, and it includes a community-based approach that will promote long-lasting change. Some recommendations for changes to the program that would increase the protection of vulnerable populations included the creation of an education program specifically for the teachers and counselors on the committee for the program. The education session would educate teachers on the impact that obesity can have on children, including physical, emotional, and also academic performance. It's important for teachers to be aware of these different aspects of being obese and what signs or symptoms they can look for and what changes or actions that they can take in the classroom. And once these teachers are educated, they can then go back to the school and educate their coworkers and other teachers that they're working with. Another recommendation would be the addition of a mental health section on the pre-intervention questionnaire. This questionnaire could determine if the child was experiencing depression, anxiety, social isolation, or other emotional or mental symptoms that children can develop related to obesity, so that additional resources and healthcare support could be given to these children. And one other recommendation would be the participation of local farmers and grocery stores to ensure that these participants have access to fresh fruits and vegetables. Many of these participants are going to be from a low socioeconomic status and will not have the financial means to be buying fresh fruits and vegetables and organic foods. So it's important that we have participation of local farms and donations to ensure that these people can get access to these foods. Ethical concerns were also addressed in the proposed program. The program addresses the needs of minority populations living in the area by having community members maintain active roles in the development and implementation of the program. The program addresses language barriers by providing information in Spanish. Children in the program are protected by having caregivers and parents present and giving proper consent. Physical activities and skills are taught to children at age-appropriate levels, and access to the program is made available to all members in the community. Those living in the community can access the program through their physician, through the local YMCA or library, or also their local school, where the school nurse will also be recruiting children. Some recommendations in regard to ethical and cultural considerations is to ensure that information is available in multiple language and to avoid limiting access to the program. Although there are a high number of Spanish residents in New Britain, it is important to have other languages available. The public health nurse involved in the program should do a thorough community assessment and cultural assessment to determine what populations are living in the area and what languages you should have available. The education materials provided to parents should also be easy to read and follow due to the low socioeconomic status of the area. Many of these caregivers may not have a high school degree or a high level of education, so it's important that they're able to understand and follow the materials very easily. The program could also provide a helpful hints handout that would give the parents guidelines and recommendations on how to eat healthier and physical activity in order to make it more manageable for them. And the program should also be adaptable and open to any suggestions or concerns that the participants may have related to ethics or their culture. Financially, this program is viable. Funding would come from the local and state governments, including the local health department, if the program was accepted. Members of the committee implementing and developing this program work mostly on a voluntary basis. The main organizer is the school nurse, so he or she would be paid for by the school, and the public health nurse on the community would be paid for by the local health department, and he or she would commit 1 day a week specifically to this program. Materials needed for the program would include educational materials like paper and pamphlets, food products, and physical activity equipment. Money or funding for those materials would come from the state governments, but would also be open to donations from local grocery stores or farmers, and the school would serve as the location for the program and also provide the physical activity equipment. Some recommendations in regards to funding and financing this program include ensuring that the program is advertised in the community to promote relationships and locate resources such as grocery stores and farms and any organizations that would want to donate to the program. It would also be important to utilize students from Central Connecticut State University who are already involved in the public health department. They would be able to assist in implementing the program. They could take measurements, ask questions, hand out pamphlets, and they would be able to get educational credit. Another recommendation would be involving the YMCA. Trainers and workers from the YMCA would be able to attend our programs and teach the physical activity portion to children, but they would also be able to implement an after-school program that would be funded separately for the YMCA that children participating in the disease prevention program could attend. Another important aspect of funding would be making sure that the participants in this program are aware and have access to healthcare. Many times people living in low socioeconomic areas, they have limited financial resources or don't have health insurance. So you want to make sure that they have access to Medicaid, CHIP, or WIC. WIC is very important. It's intended for women, infants, and children. And it gives women or parents a voucher that they can bring to grocery stores in order to get eggs, milk, or fruits or vegetables. So this is really important to ensure that the participants in this program have access to certain foods and are getting assistance that they need. So in conclusion, after evaluating this proposed program, I do feel that the program is appropriate for the stated population and setting. The age of the population should be expanded to include teenagers up to 19 years old, and the program should form partnerships and locate resources to ensure the success of the program. Vulnerable populations are acknowledged and protected, but there should also be education for teachers and counselors related to obesity and the impact that it can have on the education side of children. And there should be a stronger focus on mental health in children related to their risk of developing anxiety and depression. Ethical concerns are addressed in the program, but the public health nurse should complete a thorough community and cultural assessment before implementing the program. All languages in the community should be addressed, and the program should be adaptable to any concerns or issues that come up during implementation that need to be changed. Finance is addressed and funding will come from the local and state governments, but the program should also ensure that the participants are aware of healthcare options and any assistant programs. It is my recommendation that this proposed program is accepted as a program in the local public health department and be implemented in the city of New Britain, Connecticut. Thank you.